Good afternoon, everyone, and thank you for joining us. I'd like to welcome you all to today's webinar on healthcare leadership. My name is Aliana Ortu, and today you'll be hearing from Dr. Ledlow, author of Leadership for Health Professionals, Theory, Skills, and Applications, 3rd edition, which was recently given a perfect 5-star rating from Duty's Review Service. Dr. Ledlow is Professor and Chair of Healthcare Policy, Economics, and Management in the School of Community and Rural Health at the University of Texas Health Science Center Northeast in Tyler, Texas. He's a board-certified healthcare executive and fellow in the American College of Healthcare Executives. He has led team members and managed resources in health organizations for more than 30 years, including 15 years as a practitioner and over 15 years as an academically based teacher-scholar. He has successfully held a variety of positions, including executive-level positions in corporate and military health systems, management positions in health services, medical materials, and the supply chain, and various academic leadership positions. So at this time, I'd like to turn things over to Dr. Ledlow.
Well, thank you, everyone, for participating today. It's truly a pleasure and an honor to be with you and for you to take the time out to be at the webinar with us today. And I'd like to thank Jones and Bartlett, and specifically Aliana Ortu, for guiding us through the webinar today. So thank you very much. Leadership is a critical, important topic today in healthcare, and we need leadership today more than ever before. Given all the changes and rapid growth and movement of the healthcare industry and the constant movement of individuals in and out of the profession, we really need a strong academic teaching and mentoring, coaching base in leadership for health professions. So today we're going to talk about the textbook that is the focus, Leadership for Health Professionals, Theory, Skills, and Applications. And I've been honored to have the 3rd edition now, which I'm very, very proud to have in the industry to help with our leadership improvement throughout that industry. So the textbook focuses on building a foundation for students as well as practitioners to create a personalized leadership model. And the way that works is we build a foundation using theories and models of organizational theory and behavior. Historically, they've been used very statically in a teaching environment where a model or a theory has been explained, and then you move on to the next one, and you never link them together or use them in context. So for this textbook to focus on active leadership, the focus content cycling is we present those models and theories, build upon them, and then use them in context so that the students and practitioners of leadership can personalize a model that works for them. A football coach years ago, Paul Bear Bryant, said, we have a plan, and that's why we win a lot of games, because most people don't have a plan. So I tell my students, focusing on building their model, if you have a plan and you have an expectation of how to use that plan, you probably will do better than someone who walks into their job and figures it out as they go. If you have a plan, you have a much better chance to be successful early, and that leads to promotions and other opportunities for our students and for practitioners. So using that active models and theories from the organizational theory and behavior domain gives leadership that active element for the textbook and for the course, and it really engages students in pursuing that leadership model for themselves. What we've also done is we link current industry leadership competencies to learning content in the textbook, and there is a handout that's available that takes the Chapter 3 macro model for the industry and links it to various topics and subjects across the textbook. So if you want to focus in on one particular element of that macro industry model that is titled Challenges of Today Needing Health Leadership, then you can do that through those linked subjects across the textbook. And that gets back to that focused content cycling, that we constantly re-engage the material in a different context, building the students' understanding, because that exposure and soaking time in that material helps them understand how to use those models and theories to their advantage and to the efficacious leadership that they want to utilize in their career. So we also add systems type of content such as healthcare supply chain, preparedness, revenue management, and information systems to the leadership textbook for a couple reasons. One is students need to have exposure to these systems and understand the complexity with which the industry deals with on a daily basis, and it starts to form that systems thinking and attaches it to an operational reality of how things actually work in healthcare and exposes them to those things. Also, some of those topics are not covered in some programs. We're all squeezed on credit hours and topics that we can cover in our curricula. So this gives them at least some exposure and opens their eyes to some of these things so that maybe they can explore on their own. I've had students that were exposed to supply chain and preparedness as two examples, who actually pursued careers in those areas once they realized that, you know, I'm really interested in these topics, and they explored them and learned more about them and really have done really well in their career, starting off with this leadership textbook in an earlier edition. So those type of subjects built into the leadership textbook provide value not only from a systems perspective, but also exposure for students in topics that are of concern in the industry today. This is the base definition for leadership used in the book. It's a little long, but it encompasses most of the elements that we cover in the textbook and why leadership is so important today. And I just want to focus on a few important words. Leadership is the dynamic and active. You have to be an active leader today in the industry. Passivity doesn't work so well given the complexity and the diversity of the workforce and the diversity of the challenges in leadership today in health and healthcare. So a leader who understands that active and dynamic work is required to build an organizational culture in their organization and attach strategic systems such as supply chain, such as revenue cycles, such as clinical operations to that culture becomes really important for them to understand, and that allows you to focus the energy of leading people and managing resources and knowing the difference between that. No one wants to feel managed. No individual wants to be managed or feel managed. They want to be led. And knowing the difference between leading people versus managing them is really important. And that's a critical element as you teach people about leadership and all the work and effort you provide in the classroom, traditional face-to-face, online, or even in hybrid situations. Having students understand that difference, you bring that value in the classroom to teach them that difference between leading people and managing resources. You know, what does leading people mean versus managing them? So the textbook focuses on those differences. And also, how do we meet the needs of the external environment using an efficient, effective, and in healthcare, because the society we work in expects us to do no harm. We have to do it in the most efficacious way possible and do it morally. So people are led and resources are managed really is the theme across the textbook, and your teaching, your effort really brings that home to the students, and the textbook supports your efforts in that. So the textbook focuses on these elements, and it's really part of a learning system because there's additional resources available on the Jones and Bartlett website, and all those resources come into play to create that learning system. And we'll talk about what's in the Instructor Resources a little bit later, but it really focuses on the active use of content. And what I've tried to do in the textbook is bring in different learning modalities. There's visual verbal, visual nonverbal. Of course, in the classroom setting, you have the opportunity to do auditory learning and reinforce points during presentations, etc. But we also have kinesthetic learning through various models, such as conflict management style, assessing that style, looking at different conflict situations, and what style is most appropriate given a short list of questions. For example, using cost, access, and quality system dynamics type thinking and bringing that kinesthetic learning into the learning system. Those type of things are provided. We also focus on prescriptive models, not just descriptive models. A lot of the models that are in the textbook give students things to do, suggestions on where to spend effort. Specifically note the Dynamic Culture Leadership Model and the Bowman and Deal Reframing Organizations Model. There are rubrics built in the textbook as well as in some of the active learning assignments that gives them prescriptive behaviors and styles to use in their leadership pursuits. So those type of things become helpful because our students want some guidance and some parameters with which to practice leadership, and this gives them that. So then building those foundations of content to the point where the student has the ability, at least some basic understanding to use those prescriptive models becomes the salient point here. And that leads them to customizing a leadership model for themselves. And it can be a very simple model at first. Many of the students are exposed to this content for the first time, so their model's not going to be extravagant and elaborate. But even simple models and getting them to think about, well, how can I be a better communicator in my leadership? What type of communication environment do I want to create for my culture with my subordinates? Do I want a descriptive or evaluative environment? Do I want a confirming environment? All those type of descriptions and methods are discussed in the textbook, and students can figure out for themselves what environment will lead to better outcomes given their situation and their leadership model that fits their personality. Because we also suggest several assessments, some of which are built in the learning system. Others are free and are online resources, and the students can assess themselves, which gets to some of the basic elements of emotional intelligence. One of them is, you know, having the ability to assess themselves, to leverage their strengths and improve their weaknesses so that they can use those social skills in light of their own strengths and opportunities for improvement. And then the textbook and the learning system, they're also based on learning objectives that use Bloom's taxonomy of the cognitive domain. So every chapter goes through the progressive levels of Bloom's taxonomy, starting at the knowledge level, which is the easiest level to master, all the way through evaluation. And what Bloom suggests in his vast research on the topic is you have to master early levels, such as knowledge, to progress to comprehension, application, analysis, synthesis, and then evaluation. So we try to use Bloom's model within the learning system and textbook to maximize student learning to evaluate where they are in the process for each chapter. This is the macro model that I talked about a few minutes ago. And of course, this is a very simple model of a very complex macro model, but what we try to do here is get students to understand there's a lot of elements in the healthcare industry. All these elements require healthcare leadership and health leadership. They also require an understanding and knowledge of how those pieces fit together. So this comes from Chapter 3, and there's various elements throughout the 17 chapters and 3 appendices in the textbook that link back to the different elements in this model. And what I enjoy with working with students on using this system is we go back to this macro model and have discussions based upon elements of this macro model as we progress through the textbook. And they learn as they go, and they're able to inform the discussion as the semester progresses. And it's really interesting to see how their knowledge and their self-confidence and how they would apply leadership skills progresses and gains in you know, really their comfort level and their confidence throughout the semester as they work through the material in the textbook. So this is a great model to go back to throughout the textbook to engage your students in discussion. So I just wanted to touch on some of the selected content in the textbook. Of course, we could not cover all the content and all the models and theories that are integrated in the textbook, but these are some that I think are of particular interest to our students as they progress through the book. So the first set is really about some basic models that are very powerful. Goal-setting theory by Locke and Latham. How do you set goals? What are the domains and constructs that help you achieve goals that are challenging? Persistence, direction, focus. And we start with those simple models that are very powerful, such as goal-setting theory, and talk about constructs and variables potentially within those constructs and how their style of leadership and the different ways they lead people contributes to effective goal setting and goal achievement. Likewise, expectancy theory plays into goal setting theory and is linked in that challenging goals tend to be more rewarding with concern to instrumentality and valence and expectancy theory, and that setting challenging goals that are not too crazy but are challenging and then resourcing and encouraging your subordinates to achieve them ends up being much more fulfilling for the employee, for the subordinate. Also, theory of planned behavior, we start with this not only from a student perspective of we expect you to build some type of leadership model that fits with your personality and fits with your strengths, and we set that expectation early on in the textbook and in the course so that we're actually living out goal-setting theory, excuse me, expectancy theory, and theory of planned behavior as we go along in the textbook. With regard to leadership models and theories, we start with a few theories from ancient Greece and all the way through the Renaissance, Xenophon through Machiavelli, to the trait phase of leadership, where leaders were considered born. Nature had the major role in creating leaders. And then we progressed to behavior phase, where leaders could be trained. There was a nurture element in developing leaders. And then the phase continued to contingency theories, and we go through all those main theories that are most applicable to the health professions, and we go through those all the way to contemporary theories such as the dynamic culture leadership model and Bowman and Deal's model on reframing organizations, for example. Of note, the dynamic culture leadership model has been used in several case study competitions. One that comes to mind is the Kaleidoscope case study that AUPHA puts out. suggest the dynamic culture leadership model as a rubric for students to engage in the case competitions. Also, Schutz's theory of affiliation, and the interesting thing here is there's 3 elements in Schutz's theory that are really important for affiliating in any type of group, and your students affiliate and self-select into your program and into your course, and you can talk about those things, but people join groups for 3 reasons, and it's inclusion, affection, and control. And that's a very powerful triad of 3 constructs that leaders need to understand, especially as it works within interprofessional teams and groups, such as Tuckman's theory of group dynamics from 1965, the storming, norming, performing model. And we talk about that and how to leverage that as a leader. All those models, going back to the focus content cycling aspect of the textbook, we bring in a lot of models, such as the ones I talked about just now, and create the interprofessional team model, or the PARP model. And that model really is purpose, assemble and charter, align, resource, and perform model. And what we do is bring in all the models and theories that are applicable to an interprofessional team model from the previous chapters and talk about them and align them in a graphic so that students can go back and refer back to, okay, what was goal-setting theory? How do I use this for a group, an interprofessional team? How do I set challenging goals? What are the things I have to do as a leader to purpose and charter this group? And we use Schutz's theory and theory of planned behavior and other theories, Tuckman's model. So it gives the students a rubric and a framework with which to hang their interprofessional team development model on in real life as they think about it in the classroom, preparing for reality on the job. So we build those models and focus and cycle that content into useful applications such as the PARP model. And another powerful model that is very important, and this has to do with creating organizational culture. And one of the key aspects of leadership today, especially in health, is a leader has to be able to assess, develop, and maintain an organizational culture that helps the organization thrive. And you can create a culture at the small unit level as well, all the way up through the whole organization. And Edgar Schein has done, a miraculous job over, the last 50, 60 years, maybe 70 now, on packaging all his knowledge and research into organizational culture. And he's come up with primary embedding mechanisms. What are the key things leaders have to do to change or develop culture? And in the textbook, we focus on that in multiple areas and give students an active way to use Edgar Schein's primary embedding mechanisms. And then he also brings in secondary reinforcement mechanisms that once the primary mechanisms are in place, the secondary mechanisms reinforce it. And the key is to be consistent as a leader. Start with the end in mind type of philosophy and know what you're trying to do. And the textbook walks them through those type of considerations with regard to organizational culture. We also bring in various business models, going back to some of the systems thinking. Healthcare is very much a business as well as all about taking care of patients and families, but it also is a business. So bringing in elements such as the CAVE model and the CAT model, talking about business relationships, strategic partnerships, strategic sourcing relationships, are things that most students in health areas and health organizations don't get a lot of exposure to, but it's vitally important, especially when you're spending anywhere between 30 and 40% of your annual operating expense on supply chain and you're purchasing, having strategic partnerships and understanding what those partnerships are about and how to foster good strategic partnerships can be not only financially important for the leader, but also operationally important with regard to quality and performance. And then lastly on this slide, the 4 Ps of Health Analytics model really gives students a leadership system framework with which to look at analytics. I'm particularly interested in this one. EPIC is a beta site in Georgia is using the 4 Ps model to data store clinical information using the 4 Ps model right now, and I get a chance in a couple weeks to go visit that site for a few days to see how that's going. But in essence, the textbook gives the students the information to consider information and how it leads to analytics. You know, raw data is one thing. We have a lot of raw data in health organizations. Doesn't really help us that much unless we're able to put raw data into context, and that becomes information. And information that's actionable becomes knowledge. Knowledge used and refined becomes wisdom. And we talk about that in the 4 Ps of Health Analytics chapter. It's chapter 16 in the textbook. And we bring students, you know, through a process of thinking about how data in its various silos, and the 4 Ps are patients, populations, processes, and profitability. How we need to integrate those 4 Ps to get a better operational decision support system as well as a better strategic decision support system within our health organizations. So brings us back to systems from a leadership perspective and applies some of those personal models and theories into that system context of health organizations. This is also in Chapter 3, and Chapter 3 has the macro model, as we talked about before, but it also has a competency domain model, and the competency domains are, you know, broad and encompass a lot of material potentially, but the leadership textbook really covers the far right and far left, the communication and cultural competence, interpersonal relationships, change and organizational culture, team building, systems knowledge and thinking, environmental assessment, technology and informatics from a leadership perspective, and evidence-based analysis and decision-making. For example, we talk about decision-making from 2 perspectives. One is the rational man theory, or the rational model of decision-making, which is define the problem, list the alternatives. Well, that's not always applicable, and actually the research shows that model isn't used nearly as often as we think it is. But there's the garbage can model of decision-making, where decision load, technology, attention, concurrence of goals, etc., really come into play and change our ability to make decisions. What was found was a lot of decisions are done by flight. They, overcome by events. So how, as a leader, can we put systems in place with regard to the organizational culture to not have decisions fly by without making a good decision? So putting standard operating procedures, training people, pushing decisions down to the lower level, all those type of things we cover in the textbook, for example, in decision making. So these domains are important for leaders today because the workforce is much more diverse. We have a much greater emphasis on interprofessional teams, and the society expectation of do no harm and have no errors continues in healthcare. So a leader today in healthcare has a very complex array of domains they have to master. And to start mastery, you have to be exposed and soak in the material and be given opportunities to practice and to learn from leaders with a dynamic and active focus, not a static focus. So there are multiple assignments that are linked to the chapters and linked to those competencies we just looked at. There's a lot of assessments and learning models that are built in Microsoft Excel. Those are available in the learning system on the website that's associated with the textbook. They're all listed by chapter. And it gives students a kinesthetic view of the material where they can actually answer questions, fill out assessments, et cetera, and see, for example, what is their dominant conflict management style. The conflict management style is like a personality. Everyone has a dominant one, but you also can learn other styles and master other styles to fill up your toolbox with various styles. So given the situation, you can choose the appropriate style. The assignments are also linked to the competencies that we just looked at, and there are some video and YouTube assignments that are interesting as well to give students some different opportunities for different types of assignments within the learning system. We will look at a couple assignments here in a minute, but one assignment that we'll look at is using Kissick's iron triangle of cost, quality, and access, having students take change in the industry and estimate what the change should do. What should it do? Should it increase cost, increase quality, increase access? What should it do? And see how it plays out in the per capita cost, in how does it play out in access? Does it improve access? Does it hurt access, decrease access? And the interesting thing is when you give a student 3 or 4 things to change, and the model that's included in the learning system allows up to 5 changes, gets pretty complex, and it gives you a great way to talk about system dynamics from a cost, quality, and access perspective. There's also 35 mini case studies linked to the chapters. Those case studies also have suggested answers to questions, and those are real cases from a CEO, not only a hospital CEO, but he was a system CEO as well, and at multiple places in 2 or 3 states. So he has a wide array of experiences to provide to the students, and they're really heartfelt case studies that give the students the real opportunity to think through some of the real life issues that happen in health leadership. And then there's appendices on leader insights. What is a theory? What is a theory in previous editions was the 2nd chapter, or excuse me, the 3rd chapter, and we moved that to the appendix. Some students need the exposure to what is a theory, what is the anatomy and physiology of a theory and a model. It's made up of constructs. Constructs house variables and constants. What are the differences in those, et cetera. And it gives them sort of the skeleton of what a model or theory is. And in some courses, that's very salient. In other courses, it may not be as much. Also, the omnibus leadership model is housed in an appendix as well. Here's one of the assignments. This is a Chapter 5 conflict management assignment. Conflict management is one of the areas under communication, and this gives the students an assignment where they go into an Excel file that has a conflict management style assessment tool. They complete the assessment, see what their dominant style is. They can also look up what each style is about, what are the parameters, what are the behaviors and actions of each style. And then there's a decision tree that Folger, Poole, and Stutman did years ago that I found very useful. You ask 5 questions and it gives you a recommended style to follow for a particular conflict situation. So those type of tools are available to add flavor and learning potential for the student in the learning system. This is just an example of some of the assessment that's built in Excel where they determine their conflict style, their dominant conflict style, and the decision tree that I mentioned earlier, and the 5 questions you ask to determine what style may be a recommended style for you. And of course, they have access to what does that style mean? What do I do with that style? We also put caveats in the textbook. For example, if your only style is competing or if your only style is avoiding, that can damage relationships. If you constantly compete and you constantly avoid, that actually hurts relationships. So we do put things like that in the textbook as suggestions to consider. This is the assignment that I talked about with the Kissick's iron triangle, where you put in changes to the industry or even to the organization, and how will that impact cost, quality, and access. So they put the information into the model, and they get some response variables out of the sort of a little simulation model, and then they write up their findings and their thinking on a template that goes with this. And this gets students to understand the dynamics within the system of cost, quality, and access. The instructor resources, I just want to cover briefly. There's approximately 600 slides across 17 chapters, and those are meant to be used and customized however you feel it's appropriate for your class. We provided a robust deck of slides with the textbook so that you could decide what you wanted to use or not. There's also a robust test bank that includes test questions for every chapter, and robust assignments to include supplemental files, the learning models that are in Microsoft Excel, for example, and various templates that go with assignments. There's also an instructor manual, and as part of the instructor manual, an additional file is a teaching readiness inventory model that uses the elements of the textbook. What was done in the teaching readiness inventory, which is the slide we're looking at now, is we used Bloom's taxonomy of the cognitive domain. We used the VARC learning styles model, and we have instructors list constructs for their course, and they evaluate where the student's coming in, what's their level of knowledge, what's their level of Bloom's taxonomy walking into the course versus what you want them to achieve in the course. Do you want them to move up 1 or 2 levels, 3 levels? And then what are their learning styles? And then it looks at the frequency of how many times you touch on a topic, and of course that focused content cycling helps you with the textbook and learning system. You touch on things multiple times, and then it gives you an indication of, are you not touching a topic enough to reach your goals? Are you touching it just right? Are you overdoing it? So it gives you some rubric to adjust your course according to what your level of success is, what you think you want to achieve, and how your students, every student group is different, so it gives you a chance to evaluate your individual student group for the course as well. And each semester, each course, each section, this will change a little bit, and it'll give you hints on, I may want to reinforce this a little bit more in the course, or I've overdone this area. Let me spend some more time on an area that needs more coverage. So it gives you some indication that to maneuver your course during the semester. This is my contact information, and feel free to contact me if you have questions, or if you are interested in the assessment system that we'll talk about for a couple minutes right now. But please email me. I'm happy to respond. It may take me a day or two, but I will get back with you. I've created an assessment system linked to each course that's linked to each assignment in the course. And you basically load your program learning objectives, your competencies for your program, as well as the student learning objectives for your course, and you attach assignments to those program learning outcomes and competencies and student learning objectives for the course, and you capture that during the semester. This also produces a little grade book, and there's a data stream that runs in the background that you can plug into a compiler. And what this allows you to do is at the end of a semester, end of a year, you can look at each course, you can look at each semester, you can look at each student if you want to, and see how they are progressing in their competencies. Are they at 80%? Are they at 75%? Are they at 90%? And it gives you some competency assessment device in Excel that's manageable without a whole lot of cost. This is the compiler. The data gets loaded into a compiler. There's two files. There's the assessment tool itself that's used at the individual course level, and then the compiler is usually housed with one or two people in your department, and you, at the end of each course, you basically load in the data from the tool that was used by the faculty member, and you have that compilable information available to you. This just gives you a view of putting in individual competencies or program learning objectives and how they're linked to assignments. And also, it's customizable. You can go in and change these, of course, to whatever fits your needs. From a large 30,000-foot view, this is how it works, creates that assessment system. So if you're interested, I can send you the user's manual, operating manual. You can look at that. If you want the tools and the compiler, I'm happy to share that as well.
Okay, thank you so much, Dr. Ledlow. That was a great overview of the book and the assessments as well. We do have a couple of questions that have come through the chat. First, Dr. Ledlow, we have a few people wondering if this textbook is recommended for undergraduate or graduate level students?
I would say that upper level undergraduate students it would be fine for, and definitely graduate students. But I know juniors and seniors at the undergrad level get a lot out of this textbook. So I would say, you know, from 20 years on up, it's been very successful. So I would say it's very applicable.
Okay, great, thank you. And sort of going off of that, we have somebody wondering if you have any general comments or suggestions for how this book could best be used for some of those upper-level undergraduate courses.
I would have them read the chapter, have discussions, and focus back on the macro industry model in Chapter 3 and the competency domains in Chapter 3, and have them work through the assignments. I would still have upper-level undergraduates come up with a leadership plan for themselves, because they will start thinking about those things, and walking into a job for the first time with a plan far exceeds someone not having a plan walking in. So what I've noticed, undergraduate students, the academic focus, the professor focus really is on the first 8 chapters of the textbook, which focuses more on the models, tools, communication skills, etc. And they spend a little less time on the last half of the book, but it's still very much applicable for them. But that's what I would do.
Thank you, Dr. Ledlow. And I'm actually just going to mention, for anyone who might be interested in using just part of the textbook, Jones and Bartlett Learning does offer custom publishing. So if you found that there were a couple of chapters in the text that maybe were a bit too high level for your students, we could create a custom version with just the chapters you were looking to use. Another question for you, Dr. Ledlow. We have someone asking about the size of the course that might be best. They said that this seems like something that would need teams. So would you suggest this is best used in a course that has a large amount of students?
I've used it in a course that had as few as 7 students and as many as 60. So it works across student size. You can team students up and work on projects together, but I really don't see a size limitation on either end of the spectrum for use of the textbook.
Great. So we do have just one more question here, kind of general. Somebody just asking a little bit more about the case studies and how those can be used.
Yeah, the case studies are linked to chapters in the instructor's manual, as well as on the case studies themselves. A chapter and a topical domain, like communication, is listed for each case study. So I would link the case studies to the chapter you're doing or the topic you're focusing on at the time. That's been very successful.
Great. And I think, unless there's anybody on the line, I think that is it for questions. Before we wrap up, I do just want to let everyone know where you can go to request a review copy. You can go to this URL on the screen, go.jblearning.com/Ledlow3E. And if you were interested in creating a custom version of the textbook or customizing any of our material, you can go to go.jblearning.com/custom-solutions. And I also will be posting the PowerPoint slides to our catalog page as well, so you'll also be able to find those at that first link on your screen. So at this time, I think we're going to wrap things up. Dr. Ledlow, thank you again for a wonderful presentation, and thank you to everybody that joined us.
Well, thank you, everyone. I appreciated your time and attention very much. Thank you.